All right, thank you very much. Hi, guys. So I know the topic today is on heart health, and if you have any questions, please leave them towards the end of the presentation. All right, we'll start off with the first slide. So basic question, what is cardiovascular disease in general? It's commonly referred to as heart disease, and it refers to the disorders of the heart and blood vessels. Pretty straightforward there. So what are the different types of cardiovascular diseases that are there? The most prevalent one that we have in the U.S. is something called coronary artery disease. We also have something called peripheral arterial disease, cerebral vascular disease, otherwise known as strokes, DVTs or clots, primarily in the lower extremities, pulmonary embolisms, rheumatic heart disease, and congenital heart disease. But based on the epidemiological studies, the most common one that we have in this country, again, is coronary artery disease. So talking about atherosclerosis, exactly what is it? It occurs when you have these fat deposits, cholesterol, and other substances that can build up in the arteries, and they form this plaque, basically, as you can see in the picture there. It restricts the blood flow to the arteries, and majority of the times it can affect the coronaries, which we have coronary artery disease. And the plaque can then burst, and it can lead to a blood clot. Usually, there's no symptoms until the blood flow becomes restricted up to a certain point where it affects your organs and the tissues aren't actually getting the adequate blood supply. And this can manifest with symptoms depending on where the clot is located. If it's in the lower legs, it's a DVT or deep venous thrombosis. If it's in the lung, it's considered a pulmonary embolism. If it's in the brain, it's considered a TIA or stroke or cerebral vascular disease. And again, if it's in the heart vessels, it's known as coronary artery disease. So what are some of the risk factors? Well, let's go over the uncontrollable risk factors first. That being age being priority number one. Anybody over the age of 65 automatically is considered as a risk factor in itself. Men tend to have a greater risk of heart attack compared to women. And also a component of family history or genetic predispositions to plaque buildup or family history of hyperlipidemia or high cholesterol levels can also predispose to these diagnoses. Ethnicity, primarily more commonly seen in the African American population, Mexican American, American or Native American Indians, Hawaiians, and Asian American populations compared to the Caucasian Americans have been found to have more of a risk factor. Some of the controllable risk factors, which we tend to talk about in our primary care setting or even in the specialty setting with cardiology: smoking, high cholesterol, high blood pressure, physical inactivity, and of course BMI or overweight or obesity indexes, and other comorbid conditions, including type 2 diabetes or even type 1 diabetes. And so these are ones that we tend to focus on more because they are considered controllable. Smoking and cholesterol, blood pressure being one of the major causes. Other contributing factors that also need to be aware of, stress, alcohol consumption, and of course diet, nutrition. I would actually put diet and nutrition with this first slide because it's actually on the same level as the others in my opinion. So one of the medical conditions called hypertension, according to the CDC, about 108 million American adults have what's considered high blood pressure. It's defined as a top systolic blood pressure reading of over 130, over the bottom diastolic number being greater than or equal to 80. However, only 24% of people with high blood pressure have their condition under control. In 2017, high blood pressure was the primary or contributing cause of death for almost 470,000 people in the U.S., which is equivalent to 1,300 deaths per day, which is obviously a high amount, and we need to do a better job of getting that under control. So what is blood pressure? I know you probably see these numbers a lot. Essentially, when the heart beats, the blood goes through the arteries. This pressure that's created while the blood is going through the arteries is basically blood pressure. The top number is when the blood pressure is traveling when the heart is actually contracting, which we call systolic blood pressure. As you can see here, the number is 120. And then the bottom one is the diastolic blood pressure when the heart is actually resting or in between contractile phases. And here it's 80. And the ideal blood pressure is 120 over 80. So why does it matter? Well, it's called a silent killer because a lot of times patients aren't aware of it or do not have active symptoms that can cause high blood pressure. Sometimes it can cause blurry vision, headaches, but that's usually after it's been there for a long time or the levels are getting uncontrollably high. It's known to cause and lead to strokes, kidney failure, sometimes in severe forms or stages blindness, and obviously heart disease, which is the topic of this conversation. So how do you know if you have blood pressure? Where they did update the guidelines in 2017, and as you can see here, there are different stages. 120 to 129, that systolic blood pressure is considered pre-hypertension. And then above that, for every 9 to 10 numbers, it can go up to stage 1 and stage 2. So there are ways that I usually recommend patients check their blood pressures when they come to the office. There's one way of managing it here, but I also validate what their home readings are too. If you don't have a blood pressure machine at home, I do recommend purchasing one. There is a validated website called www.validatebp.org, which gives a list of blood pressure monitoring devices that actually go through the regulated protocol so we can trust the readings. I usually have patients check their blood pressures twice, once in the morning and then before going to bed. Usually taking the average of 3 successive readings, 2 minutes apart, usually gives you a more accurate reading at home. But blood pressure readings in the office need to be based on an average of greater than 2 readings on 2 separate occasions to be officially diagnosed as hypertension. So coming in one time with 1 elevated blood pressure reading does not diagnose hypertension. You have to have it on 2 separate occasions, either with our clinic or outside through either a dentist's office, etc. Adults being treated with antihypertensive medication are designated already of having hypertension, and we'll go over that a little bit. So running back a little bit to cholesterol, what is cholesterol? It's known as a waxy fat-like substance, and it's a primary component of many cell membranes. It's really the building block for bile, which is a hormone secreted by our gallbladder, and it helps in fat digestion, vitamin D levels, your hormone levels, including testosterone, estrogen, and other hormones as well. It's the main component really of artery clogging particles in the blood, and which is why we really put a lot of emphasis and discussion about cholesterol medication and controlling through diet, exercise, and a lot of those controllable risk factors we just addressed. So LDL is also called lousy because it's what we call quote unquote the bad cholesterol. The way it works in the body is it promotes fat deposition in the arteries. It takes it out of the organs, and that's what we don't want to happen. And as you can see at the chart here, anything less than 100 is considered optimal. If you are considered to be a type 2 diabetic, however, we want that LDL to be actually under 70 to minimize any of the risk factors. But as you can see here, the higher you go, the increase over 190 is considered very high, 160 to 189 is considered high, and then 130 to 159 is borderline high. The best way to manage this is really discussing what are healthy and unhealthy fats. Usually the healthy fats are considered unsaturated fats, which are primarily found in certain products such as avocados, for example. Really unhealthy fats include trans and saturated fats, which I usually tell patients to review on their nutrition label. But here's just a quick overview of what the suboptimal levels are for LDL. HDL is considered the healthy LDL, healthy fat content level. It's higher is better. Really, this kind of offsets the LDL because it does the exact opposite of what LDL does in the body. It takes the fat deposits from the bloodstream and the arteries and puts it in our organs, primarily our liver for storage. So we want this to be a lot higher. As you can see here, the healthy markers are distinguished based on age and sex. Anybody over the age of 19 or under age 19, more than 45 is considered to be a healthy level. Between men over the age of 20 or older, more than 40 is considered a healthy level. And then for women over the age of 20, more than 50. Over 60, ideally, will lower risk of heart disease based on the latest studies. But this is just a chart to kind of give you a reference range. Triglycerides are another subcategory of cholesterol. There are different levels to this as well. And we obviously want to avoid any high levels to minimize risk of conditions such as pancreatitis. So anything over 1,000 is considered extremely high. Less than 150 is the optimal range, as you can see here. If patients are in the borderline high category to high category, we always do have a discussion about diet, going back to the healthy and unhealthy fats that we talked about, but also considering fish oil supplements, omega-3 fatty acid tablets. Studies show that they're actually very helpful in minimizing triglyceride elevations. There are a class of medications called fibrates, which can help also decrease your triglyceride levels. But this is just a chart to review the levels that we would like you to stay at. Under 150 is the optimal range. So keeping your heart healthy, again, it comes back to, at the end of the day, diet, nutrition, having some level of exercise, at least 150 minutes of aerobic activity per week, which is the baseline level for the nation. Weight loss, which goes hand in hand with the first two. Obviously, quitting smoking. Usually Patients that have chronic smoking habits, we usually discuss nicotine patch and gum. The combination of those are found to be really effective. And then certain medications also that we can discuss about keeping your blood pressure under control, etc. Diet nutrition, elements of a healthy meal. This is the plate method here. 25% carbohydrate intake, primarily found in wheat and rice-based products. 25% of protein. This may be a little of a misnomer, but protein does not necessarily mean meat products. You can get your protein or essential amino acids in vegetarian dishes. It just means that you just have to vary it up a little bit more. Primarily found in legumes, bean-based products, and then 50% veggies and fruits, as you can see at this plate here. If you have a variable diet where you have a little bit of everything, that is overall a heart-healthy diet, but also this goes hand in hand with the exercise activity. You want to also make sure you drink at least 6 to 8 glasses of water daily, but this is just a quick overview of that. So what are the key points? Back to carbohydrates, you really want to choose whole grain breads, pastas, brown rice, corn tortillas. Carbohydrates that are made from whole grains have more fiber and nutrients than those made from refined grains. Now, some patients like to do keto diet. You just got to be careful. A keto diet is good as far as low carbohydrate intake, but it does increase the meat proportion, which can increase your fat content. So you really want to be careful with what dietary choices you tend to go for. Vegetables, you want to really get a lot of non-starchy vegetables. What I tell patients, mainly a lot of color in them. So greens like bell pepper, spinach, broccoli, tomatoes. Starchy vegetables like potatoes, corn, and peas, they fall into the carbohydrate category, but they are considered veggies nonetheless. One way to offset the level of carbohydrate intake is aerobic activity. You utilize the carbs as an energy source so it doesn't stay as a storage form in your liver. The fats, you want to really choose unsaturated healthy fats like we talked about. Olive oil, canola oil, avocados, nuts. You really want to avoid the saturated or trans fats, which can primarily be found in dairy and meat-based products, as you can see here. Cheese, butter, all of those things, especially fried foods and packaged processed foods. Sodium, it really is a driving force of hypertension, so we really want to make sure that you guys watch your sodium content. You want to make sure you read the nutrition label as well. According to the American Heart Association, it recommends no more than a tablespoon or teaspoon, 2,300 milligrams of sodium per day for healthy adults, and no more than 1,500. So really being an advocate for yourself as far as reading the nutrition label will go a long way for you. In general, pre-packaged frozen meals are a big, red flag in my mind. You can automatically assume that they probably will already have more than the daily consumption rate of sodium. So that's why it's better to try to eat home-cooked meals. So you're aware of how much salt you're adding into your foods. So exercise, yeah. So adults should get at least 150 minutes of aerobic activity per week. Just know that this is the baseline. This is the bare minimum. If you're not there yet, just try to work up to it. I tell patients, if you have arthritis, if you're worried about knee joint pain, try to do stationary bike use. Investing in a stationary bike in the house or apartment or condo is really helpful. Swimming is the best aerobic activity. I know some patients only have access to outdoor swimming pools and they don't want to swim in weather like this. So a stationary bike is a good alternative. But otherwise, treadmill or outdoor walking is a good option as well. Muscle strengthening exercises you really want to incorporate along with your aerobic activity 2 to 3 times per week. The studies are really clear that if you do high intense interval training, it's a good option. Obviously, if you're considering doing that and you've never done exercise to that activity before, please check with your PCP and making sure that you're eligible for that. Doing certain kind of resistance strength training exercises, push-ups, squats, lifting weights, those are found to be really helpful in burning carbohydrates even up to 24 to 48 hours after suspending the exercise routine. So the combination of these two are really helpful in making sure that your heart is functioning at a higher capacity. So weight loss, like I said, it goes hand in hand with the nutrition and the exercise. BMI 25 to 29 is considered overweight. Over 30 is considered obese. But I do want you to understand that BMI is a rudimentary marker. It does not differentiate between muscle and fat. I've had patients come in who are bodybuilders and their BMI index is 30 plus. That doesn't necessarily mean that they're obese. It just means that they have more muscle to a fat ratio. So we always have to take this with a grain of salt. Overweight obesity is associated with increased risk for many types of illnesses, but in general, heart disease, stroke, diabetes, and cancer are the main causes that we have to look out for, or main complications we have to look out for. You want to avoid crash dieting. That really means not binge eating. Small, frequent meals are more accessible and healthier in the long run to keep your metabolic rate up, and it helps to promote more weight loss. You want to make changes to your diet and exercise routine so that you can commit this for the long term. Trying to do baby steps is more of a successful outcome than trying to change your diet wholesale overnight. You don't want to try to change everything at once. Making these small changes, if you can stick to it for 2 weeks and add another small change that really is incremental, and over the long term, it will make significant changes over time. Again, quitting smoking is a pretty obvious one, but cigarette smoking is the leading preventable cause of death in the U.S. It increases your risk of coronary artery disease by 2 to 4 times and stroke by 2 to 4 times as well. Even if you smoke fewer than 5 cigarettes per day, it can have even early signs of cardiovascular disease. There are some websites available, smokefree.gov and 1-800-QUIT-NOW, that are really helpful for you guys if you find yourselves in this category. But I also found really good benefit with nicotine patches and the gum combination. Some patients, I tell, the nicotine patch can cause nightmares if they wear it at night. So I tell them, don't wear it at night, wear it during the day, take it off at night and put it on a new patch the next morning. Depending on how much you smoke, there are different dosages, 7, 14, and 21 milligrams. So you can give you the nicotine baseline for the whole day. And then if some patients have urges that they want to smoke a cigarette despite wearing the patch, that's where the gum comes into play. They have 2 to 4 milligram nicotine gums or lozenges that you can chew for at least 30 to 45 minutes to help minimize the nicotine adherence. So I found really good effectiveness with that. If you have any questions about that, feel free to contact me. Take-home points, though, in general, lowering your risk of heart disease is based on lowering the controllable risk factors outside of the family history, outside of the age. Stop smoking is one primary one, eating that heart-healthy diet that we talked about, getting that baseline level of exercise, and taking the medications that your primary care doctor or your cardiologist prescribes for you. Those go a long way in preventing risk. The low-dose aspirin as a preventative therapy is it's depending on your age and your risk factors. They did a study that came out last year. If you're over the age of 65 and you are only taking aspirin for primary prevention purposes, the risks outweigh the benefits in this category, and you may not need to take a baby aspirin. But obviously have a discussion with your primary care provider regarding this. You always want to check in with us, getting your annual physical exams for preventative screening and checking in on your blood pressure so we can review the data that you may have had at home. Some people have white coat syndrome, so we always want to verify that by checking your home blood pressure readings using a validated blood pressure monitoring device. So I'll leave that up to any questions. We'll kind of keep it open, and we'll go from there. Thanks for your time, guys. Guys, I see a few questions already lined up here. So I'll try to address them as best as I can. I see a lot of them, so I'll do what I can. One of the first ones I see here is, what is high blood pressure on both sides of the heart? Well, anything considering as that chart that we showed, there's 4 different stages. There's pre-hypertension, hypertension, and stage 1, stage 2. But in my practice, I usually recommend less than 130 over 80 is acceptable. Ideally, 120 over 80 would be the goal. But that would be my target range to try to get you under. I do see another question here. Let me see here. It says, is high cholesterol a given for heart disease? Not necessarily. If you try to control all of the controllable risk factors that we discussed, and then check in with your primary care provider, do your annual physicals, and just make sure that the cholesterol levels aren't going up in an upward trend. Those are the ones that you really want to just make sure and keep an eye on, So it's not a guaranteed, it's just a risk factor, and we just have to accommodate for that. And then let me see here. We have another one. Do you have nicotine recommendations in a hard copy that we can share with our providers? Those are something that I would actually see if you can talk to your PCP with first. We do have a couple of, I personally have a couple of brochures that I use as a guide, but I would check with your primary care provider for that. I see a question here about 2 different blood pressure machines that give a wide variety. Which one is a good machine to use? There is a website I do strongly recommend. It's called validatebp.org, VALIDATE BP.org. It will give you a list of validated blood pressure monitors. You can double check on that website to see if the ones that you have at home are on that list. If not, I would purchase a new machine. The problem is a lot of the blood pressure device that are sold over the counter to Walgreens, CVS, they don't go through the regulated protocol, so we can't trust those readings, unfortunately. One of those really is the wrist monitors. Those are notoriously known for reading too high, so I tend to not even trust any wrist monitor blood pressure readings. One company that I have actually had good rapport with and seen good results is Omron. Omron's a pretty good one that has really validated based on the readings that we even get in the office. So that's something that I would recommend. And you can look at that website again, validatebp.org, to double check and see which machines you have at home. And let me see here. Can you say if low heart rate is related to heart issues in the future? So low heart rate, it depends. So if you're already considered to be a person that exercises very frequently, having a low heart rate just means that you may have a very efficient heart, and it's pumping at a very efficient rate, so it doesn't have to pump that fast. If you're not known to exercise a lot and you're noticed to have a low heart rate, it could also be a medication side effect. People that are on beta blockers, for example, can have a lower heart rate. So it's something that it's very individualized. It just really depends on your comorbid conditions, if you're already staying active, etc. Let's see here. I see a few more slides, a few more questions here. Let me go through them real quick. So I see somebody wrote, I'm overweight, have been getting a low HDL. Hold on one sec. Let me scroll up a little bit here. Exercise regularly, lost a few pounds recently, just wondering what else I could do to increase your HDL. No, that's a good question. I think the main thing is really focusing on eating healthier fats. So unsaturated fats, really like the ones that we talked about, nuts, avocados, those do a good job of trying to increase some of those HDL numbers. But overall, what's more important is the HDL-LDL ratio. So what I really would put more hone on it for you is decreasing your LDL number. So that way it can offset that HDL number. So really focusing on those healthy fats that we talked about would go a long way for you. All right, let's see here. More questions. I'll try to get through them as best as possible. All right, let's scroll down. So I do see a patient wrote down, what do you suggest for overweight women with hormonal issues like PCOS or polycystic ovarian syndrome to drop the weight? I exercise at least 5 times a week and keep my daily calories to 1,100 daily, but I have not lost any weight. That's a good question. Yes, people that have PCOS have a little bit more of a harder time of losing that weight due to the way that the medical condition works. First of all, I appreciate the fact that you are staying extremely active. Dietary components in your situation are going to be even more important. Really watching your sugar intake and watching the amount of processed carbs is really going to be more important to you to get that weight off a little bit more than the individual that does not have PCOS. So that would be a good starting point. If you haven't talked to a dietitian or a nutritionist, Kelsey does offer that, and I do recommend that being an alternative, despite the much aerobic activity that you're doing. Low sugar fruits, what other low sugar fruits are helpful? That's a good question because most fruits technically have a lot of sugar. The only difference is they're not processed sugar, so they tend to be burned a lot easier than eating processed carbs. So that's really not, everything's a little relative, but I try to tell patients, eat what you enjoy, but also make sure you do aerobic activity to offset some of the fruits that you eat. So like oranges or apples, for example. Try not to overdo more than 1 or 2 a day if you can, but it's very individualized. So that would be something I would discuss in detail with your primary care doctor. All right. Should you bring your blood pressure machine to your doctor's visit? I would say yes, definitely do that, because what we can do is correlate the readings that you're getting at home to what you're getting in the office. But going back to that website I discussed, you also want to make sure that the machine that you have can be trustworthy. So just verifying that you have an accurate machine, it goes a long way. All right, let's see here. Appreciate all of the questions. I'll try to get to all of them. I see someone wrote here, I'm having problems getting my losartan filled. There is a national shortage. What can I do? So that's a good question. I would go ahead and talk to your primary care provider of going to considering an alternative if that is the case. There are other medications that have good efficacy for hypertension despite losartan if you're not able to get a refill. But go ahead and notify your PCP on that, so that way you don't go without any medication at all. All right, and then I do see one more I think I can address. What if your bottom number is always high? So again, that would really matter on what machine you're using. If you are still having high numbers despite medications, please discuss that with your primary care doctor because you may not be on adequate medication control, and so that would require an in-office visit so we can verify those readings. But I believe that's most of the questions I'd be able to answer today. Thank you so much for being a part of the presentation. If you guys have any other follow-up questions, we'll try to address them later on, but I appreciate your time. Thank you.